Hello, everyone. Welcome back on another episode on the podcast today. Well, I'm rejoined by Omer and Jess. It's going to be a really interesting conversation today because me and Jess are going to be contrasting our stories, and then we're going to talk a little bit about the ER and about with Omer what he does. So it's going to be really interesting. It's going to link up really well. So Omer, would you mind introducing yourself again for anyone listening or watching?
Yeah, gladly. So, hey everyone. So my name is Omer. I'm from Israel, and I'm going to start my 6th year in medical studies in Czech Republic. And we connected through my Instagram page, Diverse MedEd. It's where I kind of share and discuss information for both patients and medical providers on how to interact, and also clinical relevant info about different types of patients.
Yeah, so it's great we're going to be talking about this again, Owen, because it's really interesting and it's really important to talk about, especially from we're all different countries right now, I think. So that's really good. But Jess, would you mind introducing yourself again?
Hi everyone, I'm Jess. I'm an Australian now living in Belgium, and I'm a former musician turned chronic illness blogger and patient advocate after I had a health crisis at the end of 2019. And we also met through Instagram through my page, Delicate Little Petal, where I also talk about similar issues, but from a patient's perspective.
Yeah, so it's great we're all here. I think it took a bit of time, because that happens with like a chronic illness, because we all have to put our health first. So it's great we're here and we're talking today. I know we can't fit everything in today, which is why we've already said we're gonna arrange another date so we can do the things we miss out. But yeah, today we were talking about contrasting mine and Jess's story and linking it with the ER. So Jess, so I know last time we spoke a little bit about that, but about I think it was Belgium, what it's like at the moment, and then a bit different to the UK. How has anything improved since the last time we spoke, do you think?
For me personally, or with the healthcare system?
You can start with you personally, and then we can go with the healthcare system.
Yeah, I would definitely say things have improved for me personally. I had a couple of my diagnoses finalized, which is a big relief, and it's allowed me to streamline my treatment a bit more and have access to some more resources, which have been really helpful for me. I suppose the most notable thing is that I got to go to an EDS specialty clinic in July this year, which I had to wait 18 months for because it's a world-class clinic, and unfortunately there's a lot of underserved people with one of the Ehlers-Danlos syndromes who want to go there, but it was definitely worth the wait. A lot of the advice and support that I received was really great.
Yeah, so it's great that you've getting maybe things have got a little bit better since last time, because it is really important, like we talk about this, because not everyone gets the support that they should need in the healthcare system, so it's really important. How do you think has the healthcare system improved at all, do you think?
I would say that probably some of the strain that COVID was putting on our healthcare system has started to ease now. So waiting times to see specialists and things like that are a bit shorter. But apart from that, it's probably hard for me to comment because I think that kind of thing has probably overall more affected the medical professionals than patients. I would say I feel like my experiences have been better, but that would largely be because I have found doctors that are a good fit for me now and who have a good understanding of the things I need help with. So it's definitely things definitely are much easier for me than they were the last time we spoke. But I think that's just been more my personal fortune rather than changes in the system.
Yeah, because I haven't gone awfully a lot to the hospital, which because I've been okay, other than I'm not sure, I might have since the last time I spoke, I'm not sure if it was before, but I did go for a sigmoidoscopy. I'm not sure if that was before or after, But I went there, but I am due like a consultant meeting later on this year. So by the next time we do our next kind of episode together, I should have had it done by then. So I kind of let you guys know what my experience was like, because it's quite a lot of waiting considering my consultant is quite popular, you know. But I don't
Is
like
that a
waiting.
Crohn's specialist?
Yeah, it's a Crohn's. It's a person who works with Crohn's and IBD. So normally I have to wait a long time, which I like. I'm not. I suppose no one will be happy about that waiting a long time, but like I don't like, especially when you're in there. Normally I'm in there about 5-6 minutes.
Wow.
It's that quick normally. Like it's not a lot to speak about when I'm in there. I guess because I'm doing okay, but like when I bring up things sometimes that I think are a concern, they're not always taken, I guess, seriously, or like they maybe just brushed aside. So for example, like because I feel because of certain medication, but like with my hair, I have not as much as I used to, you know. And I feel like that's maybe to do with certain medication, and maybe the consultant will say you that's not known by any other patients. It's really rare, but yeah, it's really rare, but it could happen. That could be a possibility, because yeah, it's just like you would think you are in there longer, you know, but I guess it's not a bad thing, but it's not a good thing either.
Yeah, it's difficult. I think that kind of thing just really sucks for everybody, because I mean, I can only speak to my own experience, but when I hear something like that, I think like that sounds like somebody who's maybe like really under the pump, especially if you're only seeing them for like 5 minutes in an appointment and they don't have time to think about that kind of thing. But then that's also not really fair to you at the same time, because that, I mean, maybe that is bothering you, that side effect, and you want someone who can talk to you about it and discuss your options a little bit more.
Yeah, it's like it is something that like it's always it normally always pops up, really, like like I think it's more maybe like the your pain level, or like are you having any pain, or are you having maybe blood in your stools, or that kind of thing, which I do, like every once in a while it will happen. It always has, but yeah, so Omar, like how do you like have things improved your side, like with what you've been doing, like since we last spoke?
Things improved. Yeah, so after we spoke, I did get more people reaching out to me. So I've had some more interactions with influencers or patients, I would say. So I really, really enjoy that, because I think, you know, I can do a lot of, I do go through medical research and I always, you know, add my references at the end, but there is a limit how much someone like me, you know, from the side, let's say from the medical perspective, can look into the life of, you know, the patient, besides reading blogs, following YouTube, of course. So really interacting, asking, doing collaborations like I've done with both of you. Like me and Jess have already 2 posts out, and we're working on a 3rd one, collaborative, and sharing patient stories. So I do think these are really, really important things. Yeah, it's not just me, another medical provider, writing how to improve stuff just from my perspective, because also it's very limited, but also listening to the patient themselves and learning what's bothering you, or because you know really what's best in the end for you.
Yeah, because I think it's good, like the way you do things, you know, because like you sent me messages in the past, like is this post like all right to post, like I think it's good, because you always got to, I guess, be careful before you do post anything, I guess, because you just don't know if it's right, or it maybe needs a bit of improvement.
Yeah, you know, there are a lot of influencers like me, let's say, on social media, but I do see a lot of people staying in their lanes. Like I could have written just about, let's say, gay patients, since I'm gay, or the LGBTQ spectrum, like umbrella. I could have written, you know, just in this, but I did want to have this platform where someone can go and find everything in one place. I think it's really important. And let's say if a nurse, doctor sees a patient, they can go somewhere and see all this info in one place. So it could really save them time and be helpful. And I think it's okay to make mistakes. I know a lot of, let's say, my colleagues ask me, can I say this? Can I say this? Or they won't even ask someone, let's say a transgender person or some, autistic person, oh, how can I say autistic? Is it okay to say this? How should I address? So because they're so fearful, they won't even address it. And then there's like this elephant in the room. It's even more awkward because, you can feel when there's some awkwardness or hesitation. So I think, when I ask you stuff, I do know that first of all, you're someone I can ask openly and you won't get offended. And also I think it's in the way, you ask. If you're trying to learn and you actually take something from it, if like I made a mistake and you take something from it, then it's okay to make a mistake. If it's not like from a place on to do harm or on purpose. So
yeah, I guess for myself, I do prefer when people say autistic rather than autism. Nothing wrong with autism, but it just sounds better, I guess, like how it comes across. But like in a situation, if you talk about the subject, I get it's better to talk about saying the term autism. But if you're speaking to someone else who has autism, I think it's best, from my point of view, just to say they're autistic. But everyone's different. Everyone has their own way, so that's a good thing.
Yeah, that's something I really appreciate about your page, Omer, is like, obviously it is great that you acknowledge that you're only one person. You can't necessarily cover all bases and perspectives, but, previously I have been not really a big fan of the kind of like celebrity social media doctor trend. But I think what's great about your page is you do get patient perspectives and you acknowledge that there are different viewpoints and ways of going about things, and different ways of tackling different issues, and the idea that there's always more to learn. Whereas a lot of people, okay, maybe they might have more experience in a specific area, but they can be very like, this is the one way. And, I just don't think that's always the most helpful thing, because we're human beings and we're all different with different needs.
Yeah, it's very true. And I think just like, for me personally, it's very helpful that I'm trying to be aware of mistakes, and also even learning about myself was full of mistakes and full of like rights and wrongs, and asking people what it is to be gay. And then like about gay in medicine, I was learning about myself, stuff I didn't know. So it also helps kind of to like maybe humble yourself or know, okay, there are people who know more, or you can always collaborate with someone else. And also knowing that there are wonderful people like you and other influencers I work with that are open-minded and they're willing, and they want to take time to like help me maybe learn a bit or share their personal stories, which I shared a few online, but I know it's like it is a personal story, so it's not very common for some of us, even if it does teach others and help them learn for the next patient or next person they see.
Definitely.
Yeah, it's very important. I think you guys do really good work with what you do, because like the good thing about why we do this is not just because we need to. There is that to it, but there's always, it comes across as an interest of yours, and you do it because you enjoy it, and you don't you get something out of it, like that you meet new people for one. Like you always meet new people, like working with different people, doing like talking about something that you need to feel like more people need to know about it. So for example, like the good thing about what you do is because not everyone in like hospitals or like the or people don't know about it. Like that you may go in for something about, maybe me or Jess may go for something about that if the consultant knows that we have that one particular thing, but there might be another thing that we don't tell them that we have, that they're unaware of. So with your page, Omer, like having not just one certain thing, you're doing it about, you're having a variety, which is really good, because like people that, like if you share it and then people on my page will see it who have mixed followers with autism and chronic illness, and if you say something about maybe like doing things with Jess that will get her kind of people that who knows her will see it. So it kind of raises of a diverse range of different communities, you know.
Yeah. I kind of always find it fun when people like I did. I'm talking about doing one webinar for this organization, and they want me to focus just on LGBTQ patients, like just from those categories to bring just that info. And I was like, well, wait, I'm gay, but I can be autistic, I can have Crohn's disease, I can have a chronic illness, I can have ADHD, I can be more than just, Omer gay patient. I can have multiple things that I do talk about in my page. So obviously I won't talk about everything there, but I did try to suggest that you can be more than one, let's say, patient category, or you can come, you have two things, but one thing might be more prominent in this, this time during the visits. Have you two encountered this when someone might focus, like a medical provider might focus on one aspect of who you are because it's very out there and not focus on why you really came?
Yeah, it's very, it's very important because like it can be difficult, to speak about something in the first place, because unless maybe someone approaches you and asks you like how you're feeling and stuff like that. But like as we all know, there's still a long way to go with like everything, and like the more we talk about it, the more someone knows, and like the more someone knows, the more hopefully they'll tell other people,
Yeah, I think I have a story, Omer, kind of relating to what you're talking about. Even though I don't really have anything that I think would be considered particularly out there about me, I understand what you mean about maybe professionals focusing only on one aspect of you as a person. So like, for example, I was at the rheumatologist, and I'm taking an SNRI at the moment because I have PMDD, premenstrual dysphoric disorder, and that's been really great, like life-changingly good. And a happy side effect for me is that it also has helped reduce my sensitivity to pain, and that's not why I started it, but it's great that it does that. And this rheumatologist, he couldn't I suppose get his head around the fact that I wasn't just taking it for pain, because a lot of people, I think, start SNRIs and things like that to help with fibromyalgia and that kind of thing. And he kept saying when you stop taking this, or like when you get further along in your recovery, you can stop taking this, but I'm not going to stop taking it because I'm still going to have premenstrual dysphoric disorder, no matter how many squats and things like that I do to re-strengthen my body. So.
Right. And I think that's why at first I was surprised, at least on my page. Obviously, your pages probably have people who have a similar issue or in the same, other patients with other things, and hopefully also medical providers. But my page, I was surprised I got some patients, following like YouTube, because my page was at first in my head was just for medical providers to kind of help us help patients better. But after a while, I realized that until really medical providers know this as a more of a basic fact, then it's also sometimes up to the patients, also me as a patient sometimes, to kind of be aware of some things and maybe advocate for ourselves, or be aware of how we should be interacted with, and be aware of where we do need to say, oh, maybe try this, or I've seen this thing, maybe you should try this, or even get just a second opinion if you see it's not something you're comfortable with, or if the doctor is not listening.
Yeah, exactly. Well, I mean, that's why I think we're all following you, because it gives us hope that somebody's listening and trying to learn a bit more about those topics. And also we all want to know who the good doctors are who are listening and thinking about that, because we're all constantly talking in the DMs about sharing names of who's good for what conditions and things like that. So
True.
Yeah, like it. Yeah, that is why we talk to you, Omer, because we want your help.
That's the only reason. I see.
Yeah, but as well, you're really friendly, and like you're easy to talk to. So, as well as we all are, I think. But yeah, because like as we say, like things need to improve. Like we shouldn't, like as patients, we shouldn't be like, as me and Jess we've spoken the last time we spoke about having, if we're in pain, a normal amount of pain, like don't go into having to go into the ER, like as we said, and over here in the A&E, the same thing, because it's an emergency. Of course, it's an emergency, but that's like not the same as an emergency for maybe someone is maybe they're injured themselves or something. But this kind of injury is not like one you can see. It possibly could be you possibly could see if you know maybe of the condition, but you like it's really hard, and like I think most of us like me and Jess, we want that kind of stuff to change, you know, like so we don't have to go there, we don't have to wait hours to get seen, we don't have to wait a whole night to get seen, and bringing autism into this, Omer, like it's really noisy, you know, like when you're waiting and you're on like a trolley bed, you know, you're on this you're on this trolley bed and you're waiting hours, and of course you can't get any sleep. One, you can't get any sleep because probably the amount of pain you're in, and two, you can't get sleep anyway because there's so much noise. Like because of course loads of people are going in for certain different reasons, and I think that kind of stuff like would be nice to change, like if there's a different process for people who have chronic illness.
Yeah, the ER is my personal hell for those same reasons, and I don't even have the sensory concerns that go with autism. So I can only imagine how difficult it must be. Yeah.
Yeah, it's not friendly, is it? Like it is something that like it would be better to change, because like it's very hard because not everyone knows about our conditions and chronic illnesses, which nowadays better when diagnosis, like for me personally, knowing more about, like not knowing more, just they know. If I said to someone I have Crohn's or something, they'll know about, but might not know it in depth, but they've heard of it. I think that's getting better in that way from my side, and hopefully Jess's side too. But yeah, it just needs to stuff needs to improve in the ER and medical system side of things, I think.
Yeah. I think some changes might be bigger and tougher, like fixing ER. I think that's a
Yeah.
that's a big one.
Not easy.
Go easy. But I do think even, when I try to provide the information for medical providers, doctors, we do also think practically, not, besides like, let's say, of course, it's important to be empathetic and the interaction is important. But in the end of the day, I also try to show, okay, why is it practically really important to be nice or, to learn this stuff? Because I hear a lot of people say, oh, this is very American, what you're doing, Americanized, because like in the USA, they are more aware of these things. Maybe let's say at least more than Czech Republic. So I also say, hey, if you improve your communication, or, if you do these tips I had for, if someone is more hypersensitive and you do these things, you would have also an easier time, talking to the patient, treating them, diagnosing, which will save you time in the long run also. So instead of, your visits becoming 15 minutes, it might stay in the 10 minutes which you actually set for the patient. So it's actually useful to improve these things and work on these things, even if it sounds like, oh, it's a lot of work.
And you know what I think as well? I think like if you're dealing with anybody who has any like medical trauma or anything like that, going to the appointments might be really difficult for them. And I think if you're making that extra effort on like I don't know what to call it, a social level, an empathetic level, a communication level, whatever you want to call it, they're going to be a lot more likely to stay calm and retain the information that you're telling them, I think, and also be in a position where they feel able to ask questions and things like that. And so I think it does save the system time in the long run, even if it might not feel like it in the moment sometimes.
Yeah, I think some things just, I don't expect everyone to know everything I say. I think even I will probably forget a lot of my future posts because it is a lot of information, and I'm now even studying for exams, and it's a lot of information always studying medicine. But I do think some common basics should be more implemented into our studies, and the more personalized, targeted per category things. That's why I hope to form a platform where someone can look up if the patient is coming, and which, let's say, category, like the general one, they can look up some more specific things to kind of save time and make the visit nicer for both sides in the end.
Definitely. I'd be very curious to hear like what you think is missing in medical education. Is it all of that kind of thing about communication and preparation and things like that?
I would say, yeah, first of all, not sure, every university is different. And as I said, I think in the USA and the States, they are a bit more aware of these things, so they might have more time. But communication is very important. And I think most medical universities are missing some aspect of that. But even just the medical things, for instance, I know only nowadays PrEP medication, which can reduce the risk of the transmission of HIV and getting it. So that is not very, very spoken about. So even in my textbook, when we learned, it was one sentence and not very spoken about. So I think even these aspects, or dark skin patients, dermatological diseases, how it looks, we see only white skin examples, of how it would appear.
Yeah, I remember seeing some of your posts actually about some of those things. And I believe you've also researched some things about how medical devices aren't always giving accurate readings or the same readings on people of different racial backgrounds. That's so concerning.
Yeah, since that was the pulse oximetry, for example, which shows us the saturation of oxygen in one's blood. So because it was, tested on, let's say, cis white people, usually cis white men, so it was only on them. And then there is some difference when you do the same pulse oximetry on some with more dark skin. So it does show some difference, which can be very important, especially during like COVID, which pulse oximetry was very important. Oxygen was very important to give someone if they need, and that's how you prioritize.
Yeah, it's very important because like when you go into the hospital, there should be like around it, like over a certain thing that you're there for. It'd be nice to say if something happened, that like people know what's happening, because not always in the hospital, like they would take you to the place where that are specialized, so more awareness and more even training for people that aren't specialized in a certain thing would be interesting, because it would people know about it more. For one, I know there's lots of things out there, but just like if you have quite maybe lack of vision or lack of knowledge about a certain thing, it'll be nice, because I've had to get people training in schools about autism in the past because people didn't understand it properly. So that kind of stuff is in the same process in a hospital. In a way, it's almost like a school, really, because people are learning there about a certain thing, and I guess like the main consultant has his understudies that are probably learning things and on their way, and then they want to get to where he is or she is, well at that desk table. So it would be interesting, because it is kind of like a school process, a hospital in a way, really.
Yeah, it is actually, because it's like that kind of power dynamic between the teachers and the students, and between the doctors and their patients, and the need for that responsibility and awareness that different people have different needs, I guess.
Yeah, because it would be a nice idea. Like they could even do lessons like about maybe a certain thing like that, or that it'd be nice for maybe hospitals to get the patients more involved, you know, like if they wanted to, like patients go in and talk to maybe other people who are unaware, because it kind of makes them, if they take it in, that is, if they want to take it in, it's completely up to them. But a certain thing like that, because people can do that, I guess. Like they're not for people that aren't, maybe they're on their break or something, because I know hospitals are a busy place, aren't they?
Yeah, yeah. Speaking of hospitals, have you noticed maybe a difference in interaction towards you two, comparing, let's say, doctors, nurses, other medical professionals?
Because like since we all last spoke, the last time I was there, I can't remember, you know. It's been a while, because like now I would normally just go for blood tests. And it's quite funny when you do that, because you they know me, even though I continue to wear.
It's never what you want.
Yeah, they even though I haven't gone for a while, they'll know who I am, because I'll still wear my mask, even they still know who I am, because I still wear mask at hospitals, and yeah, like I haven't been in for like the last, like I said before, like the sigma endoscopy was the kind of last kind of operation, not operation, it's not an operation, is it? It's a lot like a kind of thing I've gone to, but that was last year. But normally it's basically it's basically just blood tests, which I'm okay with now. Like I'm not a needle person. As we're recording it today, I actually had my Crohn's Humira injection, so that was okay. I normally scream when I have it, only because it's funny, you know, I either scream or laugh, just to make me go off track a little bit. And then I just reward myself afterwards, because every 2 weeks I have something nice afterwards, just to, I don't know, reward myself and say I've done all right, I've got through another 2 weeks. But it is I'm not one for, I don't really like needles, so I have to, when you have a chronic illness, you learn to like them, don't you? But
yeah, or like you get desensitized to certain things, I think.
Yeah, it's something that you get. I never used to like them. I always had the ice on certain things, like blood tests, for example, always the ice. But then I thought it just makes me cold now. It's almost like when you get older, I guess, that you like certain foods that you didn't before, and that like with your taste buds, like your taste buds change, don't they, as you get older. But that's sort of in the way of having injections. Like as you get older, you get used to them, and not that you like them, but you kind of in that mindset that I have to have them now, so I can't really do anything about it unless one day, a really good day come along where something happened where I wouldn't have to have any. But it, because that's the risk, like especially because we're more it's dependent on everyone, not everyone. It just depends what we take, I guess, and what we do, because if we're at risk of a certain thing, because we never know what's going to happen, and it's really important, like say something dramatic happened, which is why we speak to you, Omer, about like the ER, because like something, if we're for example, if something's really bad and we explain to the person at the desk about something, and they don't take it in, that what we're talking about is really serious, not that everyone else is not serious, it's just because we have a chronic illness. We don't know if they do or not, have people there, but so, like because chronic illness has just been, it's been going on for a long time. You know, it's not like it's a new thing. Like centuries on, you would think maybe something will be other people would be like how we're feeling, that it's not right that everyone should be like going in the same place if they don't have if they're not in a chronic illness sense to us.
So I feel like what you're saying is almost like what we need is something in between the ER and the GP for something that's like, it's urgent for us, but it's not a life or death emergency that's suited to the really high pressure environment of the ER.
Yeah.
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 That's tricky. That would be a big change to the way things are run at the moment. But I really agree with you. I wish there was a way that we could solve that.
Yeah.
If I can just piggyback on what you were saying, I think, Omar, in response to your question, like my experience with urgent care has been quite mixed. But I wouldn't really say like it's dependent on the type of professional that I'm seeing. I think it's kind of similar to what Mason said in terms of like, it's more to do with the type of issue I'm going in for. So I've had to go a couple of times for an anaphylactic allergic reaction. And if you want to see some quick action from doctors, I recommend anaphylaxis, because you'll never have to wait any time at all at the ER because they don't want you to die. So that was obviously, I mean, not that it was nice, but I didn't have any issues. I obviously felt like they acted really quickly and I was very well taken care of. I think that it's when you go in for slightly more obscure or less visibly obvious issues that things can be a lot more challenging. So I had to go once for, it was for migraine, but at the time I didn't know that because I had a paralyzed arm. And so obviously wanted to make sure it wasn't anything else more insidious than that. And the attitude that I got initially wasn't very friendly, because the paramedics brought me in a wheelchair because I wasn't able to stand because my heart rate was being so fluttery. And then when the triage doctor got the results of my, come on, Emma, what's it called when they put all the electrodes on your chest to check that? ECG? EKG? ECG. Yeah, then their whole attitude changed because my heart rate was really weird and very fast. So yeah, I mean, like, obviously I got the attention I needed at the end, but it's a little bittersweet for me because I didn't really appreciate that they were like, oh, well, now the machine says it, so now we believe you. They could have just believed what I had to say in the first place, you know?
Yeah, I think there's, if you watch House MD, he always says the patient always lies, which is a very, like, funny idiom he says, but in real life, I don't think it's a good thing to live by, to think the patient.
Sorry, who says that?
House MD, it's a TV show, old one.
Oh, that show where they constantly portray medical professionals as going to the nth degree to help everybody with complex rare diseases.
Yes.
That really realistic show. Yeah.
Super realistic, yeah. So I was a huge fan of Dr. House, love the show, but the concept of patient always lies is not a good concept to live by in real life. Yeah.
I agree. I mean, I think I understand like kind of I understand what's behind it, because I think humans, I would imagine what he's really saying is humans can never be objective about what's happening to themselves. But I feel like maybe like phrasing it in that way is a bit reductive. Yeah.
Luckily, he's not a real doctor, but great actor. Actually, he's British. I'm pretty sure he's British. Yeah, and I think a few weeks ago, before I posted another post about chronic illness with a different influencer, I was actually talking with you, Jess. I was asking you about mental health, right? I was asking you what you think of the questions or which questions can be helpful. So because you two do go a lot to the clinic or hospital, right? What do you think? Do you think mental health is something that should be asked, addressed, in the hospital, clinic by a nurse, doctor, or is something more, that's like more of like a psychologist area?
Well, the problem is, and I'm not sure how things work in your countries, but certainly in the case of Belgium and Australia, how are you going to get to the psychologist if the doctor doesn't ask you about it first? And I think that's a big part of the problem. So for me personally, like I've been very lucky because I feel like I've grown up, you know, with a family who doesn't stigmatize mental health, and I've been encouraged to speak up about my feelings. So I've been okay about talking to doctors if I need more support for my mental health. But yeah, it's not something I ever really get asked about at the hospital or in clinics or anything like that. And I think that is a bit of a worry because not everybody's as lucky as me. So I think it would be good if doctors could sometimes prompt patients to at least consider talking about it, because especially like we may not even know or like be consciously aware that our mental health's not good. Like if we're struggling physically, especially like in the case of Mason and I with our chronic illnesses, I know like my mental health really suffered during the diagnostic process and pre-treatment, because it can be a very grueling and disheartening time when you have all these symptoms and you're getting dragged around to all these appointments, you know, with no answers and no helpful intervention or symptomatic relief. And yeah, it would have been good if somebody maybe had have said like, you know, are you coping with this mentally? What can we do to make it the process more bearable for you on an emotional level?
I think in Israel and in Czech Republic, medicine healthcare is free. So you do need to go to a doctor to be referred to a psychologist. And I know the waiting list is really, really long. So I think a lot of people, if they can afford it, do go private. I think also in Israel, it's maybe discounted if you go through the doctor, but I think a lot of people also go just privately because it's just faster and easier usually than going through the medical, the healthcare system.
Yeah. I've got a situation I can share about one of my experiences. Well, it might be my last visit. Yeah, I went to a meeting like and they said it was to check out how my Crohn's were and stuff like that. And they said, I said, how you doing? And then I responded in a mental state, like how I'm feeling that kind of way. I was like, I'm really anxious, like, and stuff like that. And then the person didn't even take any notice what I said. They said, I meant, what do you mean, like, with your Crohn's? Like, and then I kind of bypassed what I just said. And then kind of was blank to what I was saying. So like, kind of like, I don't know what I'm going to say. So like Jess was saying, you don't really get asked like about your mental health, like how you, that people may occasionally ask you how you doing, like how you've been doing, like you do general conversation with people, but not like in terms of mental health and stuff like that. I don't think it's talked about a lot in mental health. I certainly have spoken about it more maybe during lockdown. Definitely I've spoken about it more during like the lockdowns and stuff like that, but not in a hospital sense. There hasn't been awfully a lot that people ask. And if you did like that situation, I don't know if anyone else will respond like that, but in one of the experiences I had, they kind of just blanked it.
Yeah, I would have thought like, even if that's not what they're there to do, would be a lot nicer and more productive if they could have said, you know, like, sorry to hear that it's affecting you in that way too. And unfortunately, that's not something that I can help you with today, but here's a number of my colleague, or here's a support service or something that you can look into. You know, how long did it take me to say that? Like 10 seconds.
Yeah. Yeah, I'm in there 6 minutes. So it's just an extra minute of his time or her time. Yeah. But yeah, like, I guess it's just they don't know. Like they feel like I don't have knowledge in this area. But mental health affects all of us really. So they should have some idea what mental health is, because I feel like in the world even it is talked about more than it has been, like even like before a few years ago. It wasn't talked about much, but now it has, and it goes alongside with what you have or yourself, like a chronic illness. It impacts you in that, like people in different stages. maybe like Jess said, like a diagnosis, which can be really hard. And I think it does get easier once you kind of get under wraps of what it is and you understand a little bit about yourself. And it can be, if things like mental health can affect your how you are. Like some people don't speak about it, you know, like about it within a chronic illness or at all. And it is like it is very interesting in a way if someone listening to you tell your story about how your mental health's been, because like people see you're doing okay, but you're not really.
Yeah, definitely. Appearances can be pretty deceiving in that regard. So I kind of think, I don't know what you guys think about this, but I think there's very much a strong intersection between what we're talking about with physical health and mental health and how it affects us in our interactions with our doctors, and what we were saying we were going to talk about in terms of how we advocate for ourselves.
Yeah, because I agree, because how we advocate for ourselves is like it's very important, like to us, you know, like because it is hard, I guess, at the start, like of our journeys to advocate and stuff, because like I don't know, it is very hard to even like create your page, you know, and talk about your journey on it. Like I like 5 years ago, or I would never thought I would be talking to you guys. Like in a way it helps, like I guess. Like I wouldn't be talking to me or Jess if we probably didn't create our page about our own journeys, and if Omer, you didn't start what you were doing, you wouldn't be here either. So it's good that we're all doing what we're doing.
Yeah, it's very true. If I wasn't doing what I was doing, I wouldn't have found YouTube, and I'm really happy I did, because I am learning a lot. Like since I started this in January, and before when I was researching, I was astonished at the amount of information I didn't know, and kind of terrified, because I was like, if I didn't know now what I know, and I would have had one of you as a patient, I would have probably missed, or not even misdiagnosed or missed, but I would have missed out on things that could provide better or better interact and, you know, ease your visit much more than if I just behaved according to the textbook, for instance. And
so on that note, I mean, are we going to talk about our diagnosis stories and how it maybe would have been nicer if other people had have taken that attitude?
Yeah. Would you? Yeah.
That's a good segue.
Yeah, definitely. Do you want to start, Jess? Like,
oh yeah, definitely. Yeah, I wanted to bring this up because I remember when we did our first podcast episode together last year, Mason. I was really impressed because you told me, correct me if I'm wrong, but when you're initially in the ER for some symptoms that turned out to be related to your Crohn's disease, it seemed like you were immediately very confident in terms of pushing back, because they wanted you to wait. I can't remember how long, but a reasonable amount of time given the severity of your symptoms, and that would have put you in quite a lot of danger if you hadn't have pushed back. And I think that's really admirable, because that's very at odds with what I did. And yeah, I would love to know when you talk more about your story, where you think that came from.
Okay.
Yeah.
Yeah.
I think it would be really helpful for other people to know. But so I kind of have two stories about diagnosis, and they're quite different. I think they're like two different examples of how the diagnostic process can be difficult, and how it's kind of affected with some of the issues around medical gaslighting. And the first story is about a time that my family and I, we did fight really hard for me, but we were all quite traumatized by that process, and that really affected my approach to medicine going around the second time, and kind of really destroyed my ability to advocate for myself, unfortunately. So the first story, I used to have a condition called hypoadrenalism from HPA axis suppression. It's tricky to explain quickly, so maybe what we can do is we can just link a resource about it if anybody wants to know more about it, because I don't really think we have time for me to go into all of that right now. So yeah, when I was in my early teens, I was being given inhaled steroids, well, a combination of inhaled and oral steroids for my asthma. And at that time I was getting a worsening congested cough. And my immunologist at the time kept upping my dose in response to this cough that just wouldn't go away, even though I wasn't really responding super well to the treatment. And I started getting kind of like some weird problems around this time, like with dizziness and fatigue and loss of muscle tone and stomach pain, just all these like little weird things that didn't seem connected at the time and were really easy to just explain away initially as normal life stuff. But by the time I got to about 17, those symptoms had got really bad. I lost like quite a lot of weight, even though I was constantly hungry and was just eating everything nonstop. And I started having a lot of issues with memory and confusion, and lots of issues with recurrent chest and sinus infections too. And yeah, to put it bluntly, I was absolutely just treated really appallingly when I tried to get to the bottom of this. I would say some of it you could classify as medical gaslighting and some of it as medical negligence. I was told by multiple people that there was nothing wrong with me. Yeah, some of them, I apologize, this is still really traumatic to talk about, despite all the therapy. I was told to go on antidepressants. One doctor told me that I needed to learn how to do work when I was tired because everyone was tired. One actually had the audacity to tell me to cover up if I wanted to stop getting chest infections. And if I hadn't have been so young, I would just never let a comment like that slide now, but I was a teenager, so I didn't know any better. And when my family and I started wondering if there was a link maybe between the steroid medication and these problems, we pretty much had to end up demanding that I be seen by an endocrinologist. I'm really glad that we did, which is how I got the hypoadrenalism diagnosis. Basically, the shortest way to explain it is as a result of taking that medication, I developed a secondary problem where my cortisol levels were really low, which is one of the stress hormones that comes out of the adrenal glands. And my cortisol levels were about a third of what they should have been. And you would think, wouldn't you, that like the problems would end there when there were clear biomarkers on paper showing that something was wrong with me. And yeah, I would say this is kind of the point where I kind of rolled over and stopped advocating for myself because that event affected me psychologically so much. Yeah, and even though I've talked about it a lot with people in our community, you can see it still is something that really affects me. And I don't know if it's something I'll ever be fully okay with or over. Yeah, I just didn't have the strength physically or mentally to keep advocating for myself. And yeah, it wasn't until the next time I had follow-up tests, my cortisol had gone so low it wasn't detectable in my blood sample anymore. So then I got hospitalized and I got referred on to a new endocrinologist. And that's when I finally got like proper treatment for it and got way, way better. But I mean, I think we can all agree it's fucking ridiculous that that's what it took to get treated. So I am really lucky that I didn't sustain any like lasting physical damage from that. But yeah, it's obviously really different. I wish I had have been more like Mason and had have just kind of pushed for what I wanted straight away. Yeah.
Yeah, I'm so sorry about to hear about all that, Jess, because it is really like it's upsetting, isn't it? Like I had to go through all that, and I'm sure Omer agrees there as well. But like contrasting my story onto what you said, um, like before going into what happened, um, I just want to say one thing that does offend me when, especially when I was diagnosed, because I lost lots of weight, and then
Mm.
I was at school at this point, and in my last year of school, and I go on the taxi, and I say, "Do you notice anything different about me?" And because of course you surely did. In my mind, it's a no-brainer. And then he said, "No, no, you look the same. Where have you been? You've been on holiday?" And I was like, "On holiday? I wish. I wish I was on holiday." But yeah, that kind of stuff offends me. But going back,
Sorry, who did you say that you said that to? I didn't quite catch that.
I said that to my taxi escort.
Ah, okay, okay.
Taxi escort. But that is, yeah, I just didn't really notice or anything. Because I guess I didn't tell many people. Like I when I was before I was dying, I did what I didn't know what was going on. I kept things. I wanted to keep things quiet. I didn't want to tell anyone. At school, but I didn't have any choice because it was happening at school, and I couldn't really say until I knew properly. I was just in some sort of pain and discomfort. But what happened was when trying to push, um, which was it was more my mum really because she was the one who noticed something was wrong. I wasn't eating. I was lost an amount of weight, loads of weight. Um, and one thing that I don't like it when people lose weight with a chronic illness is people say that you look good and stuff like that, which
Yes.
it's really annoying, you know?
Yeah. Yeah, I totally agree. I think this could be a whole nother podcast
Yeah,
topic in
I'm
itself, is
sure.
weight stigma stuff, because
Yeah,
I was similar. Like I lost a lot of weight too. And yeah, I got a lot of compliments. And yeah, like people not being able to understand that weight loss isn't always a good thing.
no, it's sometimes really unhealthy, unless you're intending to, which in our cases we weren't not intending to, right? But within like fighting to get seen and stuff, um, like you go to a meeting with them and they say, nothing's like this is when I'm in an enormous amount of pain still, saying that you can't get seen and like, and then it was very dangerous. And then when I eventually did get seen, but much sooner than I intended to. Like so, it went from it was going to be a few months down the line, and then they hurried it up because I think that was purely because I wasn't eating as well. I got to a bit where I weren't eating things, and I didn't like the drinks, like the liquid diet drinks, so I didn't go on them either. So it come to a point where I think they were fed up in the end of people nagging to get seen, because if you nag, they get bored. So they probably think to their heads, if I just do what they're telling me to do, the nagging will stop.
And would you say like that was your attitude? Did
I,
you think, oh, I'll just keep nagging them and eventually something will happen? Like, I'm just curious, like, I suppose, as to how that experience of finding it really hard to be taken seriously, like, if you don't mind me asking, like, how did that affect you? Were you always,
um,
yeah, because in general, you seem like a pretty optimistic person when you deal with challenges, but were you always optimistic through that? Or did you find it like really emotionally challenging in that situation where you had to really keep nagging and pushing hard to get your concerns taken seriously?
it was a challenge because not like they didn't know, no one knew what it was at the start, and having to have like a kind of endoscopy and different tests. And for me, getting diagnosed with chronic illness is hard. It's not like an easy process. So
Mm.
like it's good that I say I don't think got told pretty quickly, and then but it is tiring. Like when people don't believe you and that you say them out times, and people still don't believe you. But yeah, it wasn't the easiest of processes.
Definitely. Like what I was going to follow up with in, I suppose, like contrast to the story I shared before, is that even though like I've had a lot of support and I've been able to shift my mindset now, something that I really struggled with was I guess just like trusting my instincts after that experience of, I suppose, medical negligence or gaslighting or whatever you want to call it. Like, even though ultimately, like, I was right, there was something wrong with my body, but, you know, I was told, or it was implied so many times that I didn't know what I was talking about, that I started to believe it. So I feel like that really impacted me going forward. I really avoided going to the doctor. I found it really hard to talk openly about symptoms or things that were affecting me. And, you know, even though I've got it all tied up now, it did make it really hard to get eventually diagnosed with EDS and fibromyalgia. And I just think it's an interesting topic because I kind of feel like the responsibility is was a lot more shared in that second scenario, because on the one hand, I don't think that I did a very good job of explaining what my symptoms were, how they're affecting me, why I was seeking further testing and treatment. But I also think that doctors should have done more for me in that scenario to push things along. Yeah.
Doctors need to improve the way they do it, but it's hard, you know, because it's good when you have a good support system, like people helping you, thinking like, is it something else? Or like at first I thought it was just illness, or I was maybe ill or something, and then it got to the stage when you're losing all this weight. First of all, the pain didn't come. Losing the weight came for a little bit, and then the pain came, like, and then that went nice, and then I was in the flare. Then I was in remission for a little bit, and then not then out of remission. So it is a process that, like, that everyone in the world isn't going to understand where you're coming from, but it's hard. I guess you have to learn, or we have to kind of accept it ourselves. Something isn't right. As much as we don't want to go to the hospital, as much as we don't want to get seen about this kind of stuff, like if we tell them how it is, like how we're feeling, like on the brink of probably near death doors for some people, because it feels like that, you know, like no one wants surgery, but these kind of things have to be taken up. Yeah.
Definitely. So have you felt like you've always had the ability to kind of, like you just said, tell it like it is, even if you're feel like you're on death's door or whatever?
Yeah.
Or has that been like a difficult skill for you to learn?
Like I've never been the person that would speak out about certain things. It was more my mum who kind of did it all, but I was saying how I was feeling and stuff like that. So I kind of helped, and doctors wouldn't always take it seriously. That some people maybe were uncomfortable about doing different things, and it is. I've always been like a quiet person, so, and then as soon as I think I got diagnosed with Crohn's, I kind of come out of that, and like I don't care anymore. I've got a chronic illness. I can say what I want, but like in the terms that I'm not worried about what people will think of me, because that's what I did think. I thought people are going to think I have something different or something, but yeah, I think having a chronic illness does boost your confidence. I think it helps it in ways.
Yeah, that's so true. I think like if you had said that to me 5 years ago, I would have completely disagreed, but now I totally agree. Yeah.
Yeah, I didn't think that either 5 years ago. So
yeah, I think it boosts your confidence and it develops you as a person. Like if you have the right time and support to process it and think about, you know, it does make you really think about what your values and priorities are in life. That's for sure.
But definitely, and like you can do things like I'm always one, like I went on my first holiday after I was diagnosed, and I thought it was okay. I went because I thought I was okay, and then I go toilet and then I've got quite a lot of blood, and then I'm not very happy. Like the first time I get that, like those kind of symptoms, that you're quite sad, and it's not a nice thing. But those are the things that we're not going to tell everyone. We're not going to tell someone like strange on the street or someone new. Like I think it's hard to talk about those kind of stuff because some people may take the mick, or if they don't take the mick, they may just not be very friendly about it. But it's just stuff we have to do, don't we?
Yeah, definitely.
Yeah.
I find it very hilariously relatable about how you had to go to the bathroom and you were like, it's quite a lot of blood, because I feel like that just sums up the chronic illness experience, because we get so we're resilient, which is great, but we get so desensitized to things that would freak so many people out.
Yeah, like even before, I always get nosebleeds, like like quite a lot of the time, and it's crazy. Like I'm always full of blood anyway, so Crohn's or not. But yeah, like you say it to someone, you say, I've got blood in my pants, and then there's like, what do you mean? And then yeah, it is something that like known, but not every chronic illness, not all chronic illness or just a toilet centre condition. Like it's another thing for another podcast episode, but that's another thing that it's a topic. But yeah, before we finish, is there anyone else does anyone want to bring up or anything else, or say anything?
Yeah, as like someone who, as a listener from the side, I think it's really amazing and interesting how, despite you just shared, let's say, your origin story, so your stories might be very different and how you reacted, interacted, and what happened, but in the end you both decide to take an active stand, and you both, you're in podcasts, you have blogs, you're on Instagram and YouTube, and you're really advocating and sharing your experiences. And I can kind of understand how it might be tiring. Let's say as a gay guy, I get asked a lot of how did I come out and these things, and it can be very tiring repeating a story, even if it's very helpful for others, to learn and understand. So I think it's really amazing that you two are advocating and sharing very, very personal stories on a podcast like now, what you shared with me and with everyone who's listening, and you're always keep advocating. So I think it's really amazing, and I'm sure you're helping a lot of people who might not know what they have, and this is like, maybe I do have something, or maybe I need to advocate for myself more like they do. So I'm really grateful I get to talk to you and I got to meet you.
Thanks, Omer. Like it's great to talk to you too, and Jess, because me and Jess kind of connected. I think it was late last year, wasn't it, Jess?
I think so. Yeah.
And then Omer, we connected. Was it in March?
Yeah,
I think so, because I had you on the I did the autism based series, which is good because we didn't really talk about Crohn's side of things. We talked about like an autistic kind of way. So it's good that this time we've kind of discussed about like the ER, which wasn't really discussed back then. But yeah, it's been great speaking to you both, and of course we have so much more to talk about when we do it next time.
Yeah, thanks, Omer. I appreciate your kind words. And a small suggestion for you, something that's worked really well for me. If you're sick of people asking you to tell your coming out story, just write a little blog post about it, and then next time you just send people the link if you don't have the energy to tell the story that day.
I like that idea.
Yeah. You make a post. Like you could do that. It'd be interesting because it is tiring repeating yourself. I bet it's like just but especially all the time, it must be a pain.
Yeah, I guess like with you two, it's always a struggle of you want to educate and help like others understand if someone's asking for a place of like I want to learn, but also like that's why I also connect with you, but also try to read by myself, so I don't always bug you with questions where I can Google or read your blogs, for instance.
Yeah. Yeah. Right. Well, we're always open for questions, so you shoot us anytime.
I appreciate
100%.
it.
Yeah, I agree.
Yeah, definitely. Well, I think that kind of wraps this up really, but it's been great speaking to you both again, and I look forward to when we do it again because we got, like I said before, so much more that we can discuss.
Yes, for sure.
Yeah. Well, thanks guys.
Thank you.
Thank you.